Okay. The license of local doctor Johann Kruger is set to expire here July 27th. Dr. What?
OBGYN.
OBGYN, sorry. Is expiring here very soon. He's a very well-liked doctor. His reviews are through the roof. Yeah, just fantastic.
You can't find a bad. Well, there's one, but apparently he's one of the top 6 doctors in the country.
Yeah. His problem, he can't pass his test.
Yeah.
So he's got the practical down. No, he's got the theory down. It's the practical that's hurting him. What it is, it's basically a checklist system. So you say your name, check. You say it's Johann Kruger, check. He should get 2 points because Johann Kruger is one of the coolest names I've ever heard.
Basically, the doctor goes in the room with a tester. I imagine that's how it works. And the tester stands over his shoulder, watches the doctor give a diagnosis, and he checks him off.
Right.
And if
Did you mention your name? Did you ask for past history?
That's the parts he's failing on. The kind of the stuff that doesn't really have a lot to do with the diagnosis, but it might have some significance that I can't conjure.
Yeah.
But he's failing on the stuff like getting the name and past history.
Right.
He is a really good doctor, as we've said this before. He's highly regarded as one of the best in the province.
Mm-hmm.
We actually have a video.
Right.
Of Dr. Kruger at work. Have a look.
Okay. So, as you can see, his bedside manner is top notch.
Yeah, but seriously, that was a joke. That was a joke. I just want to further clarify how good of a doctor he is. Brandon Thorpe, another doctor at the hospital, the one who pulled my child from the womb, had very good things to say about him. We've got a quote. He was in the newspaper as quoted as saying this.
You can see that it's imperative that we keep Dr. Kruger in Five Hills. To allow him to leave is a disservice to the patients, whose mandate you, as the College of Physicians and Surgeons, have to protect. If he leaves due to a license issue, it will be a devastating blow to medicine.
Devastating blow to medicine. Whoa. Those are big words, but on the topic of big words, and on the topic of maybe what some would say bloated statements, Dr. Kruger himself had something very poetic to say. I'm going to read this one. Where is it here? I'm going to read this to you. Why did they allow you to work for 10 to 15 years, then all of a sudden one day you're not good enough? I think the Royal College of Physicians and Surgeons should let you write the exam before you come to Canada. I think it's inhumane to let somebody come and then say, now you write your exam, and if you don't pass, we don't want you anymore. That's a human rights issue. As far as I'm concerned, it's nothing but the 21st century form of slavery. Whoa! dial her back a notch there, Doc. Okay?
Yeah, I do agree though. They should have done that, but we were in such need for doctors at a time that it was maybe a little slack.
Right. I want to address the slavery. Okay, first of all, it's not like slavery at all. Slaves don't make $150,000 a year. Okay, all right. Slaves are there against their will. Right. Nobody's whipping you, Doc. Right. It's what is the 21st century form of slavery? Slavery, because it still exists. Right. And even the inhumane kind of bothers me too, because that's not inhumane. This doctor is from South Africa, where they still shoot protesters dead in the street. That is inhumane. What we do in Canada here, it might not be to your liking. It could obviously use changes, but it's not inhumane. Right? That's it. I got that off my back.
Okay, good.
Okay, but so basically what's happening is he's been offered sort of an ultimatum. He can go to the University of Winnipeg and take a 6-month course.
Yes.
And if when he's done, he'll write the exam. That will teach him. He's refusing to do it, right? So basically, he's saying he doesn't want to, practice. He doesn't want to practice.
It's easy to sum it up when you just talk about practice. We sitting here, I'm supposed to be the franchise player, and we're in here talking about practice. Well, Coach, I mean, listen, we talking about practice. Not a game. We talking about practice.
Even Iverson had to practice.
Even Shaq had to hit his free throws.
Yeah. Okay, I agree. As I said before, I agree that maybe the licensing process could use some reworking to make it so that people of his ability, who are obviously good enough to work here, can't not work here. Right? I
agree.
agree.
We have to do it a different way.
Yeah, we have to do it in the system we have in place, right? The way to do it would be to lobby the Royal College of Physicians and Surgeons and have them change the regulation on testing, right? Not to just let a star player push through the system.
And if it turns out that, you know what, we lobbied and we tried and it doesn't work, then just you got to go hit the books.
You got to hit the books.
Just do it, Doc, because we want you.